Hey there, my name is Zachary Eason, and this is my assignment for the GPT AI software video presentation. For the communication challenge topic that I chose language barriers in healthcare, specifically to the United States, but I guess you could wrap that to the whole world, of course. I chose to do this assignment just individually. Just because I feel like most of the time I work better individually with this sort of thing. But yes, so the communication challenge was language barriers in healthcare. This is a common problem where we're called the melting pot as a country, and that's because we have so many different people from around the world with different languages, dialects, and everything in between. So I went on ChatGPT and just looked up language barriers and differences in healthcare, and it came up with a good bit. It started out just saying that it refers to the various linguistic barriers that can arise between healthcare providers and patients due to differences in language proficiency, dialects, accents, or cultural nuances. It can significantly impact communication, diagnosis, treatment, and overall healthcare outcomes. But it went on to name some key aspects of language differences in healthcare. And this could be things like the language proficiency, where some patients just, are limited and can't really explain everything they're feeling to the degree they need to. This can lead to misunderstandings or potential errors in diagnosis and treatment. There's also interpreter services where usually every healthcare facility has an interpreter, but of course we don't have an interpreter that speaks every language, so to say. So sometimes that can be the problem, is finding someone to actually interpret for them. Cultural sensitivities can be that sometimes they don't want to share certain things with the provider. Health literacy can be, they just struggle to communicate what is actually bothering them. They may just say their stomach hurts, but they can't really narrow down a certain spot or communicate that. And then dialects and accents, of course, can just make or break the situation, essentially. Sometimes someone will say something to you and you're like, I think I know what that means, but not exactly. And then, it can affect things like documentation and record keeping, as well as training and education. If you're not trained or educated necessarily right, you're not going to be able to communicate that well. And then that can also, at the end of the day, lead to all the documentation and record keeping being a little broken up. So I did do some of my own research. I looked into different medical institutes around the United States, and I looked at some of the best ones, like Johns Hopkins, and I looked at some of the worst ones, which were obviously kind of out in the middle of nowhere. Johns Hopkins has hundreds of different interpreters that speaks all different languages, while some hospitals kind of out in the middle of nowhere might just have a Spanish interpreter, and that's about it. So overall, ChatGPT's info was pretty accurate and very well leading, as far as like it didn't go too far into depth of certain details of like certain citations from certain institutes. So that's where I went and did my own research on like Johns Hopkins. I even looked at Duke University and different places like that, but ChatGPT didn't give me specific places they found this info. But my personal thoughts about the topic are just that it is something that we need to continually work towards, considering this country is so diverse. A lot of people suffer in healthcare because of these language barriers and I guess you call it improficiencies. But overall, I think using ChatGPT was really cool. I've never used it before. It did help give a few good points that helped me with my research, and just my overall opinion of the matter. Even came up with extra key points to kind of back up my own thoughts and argument, so to say. But I would say that that's the benefits. The challenges of it are just kind of maybe finding more specific information or where it pulls its information from. So overall, it was a good experience. It was cool, but yeah, with language proficiencies and language barriers across healthcare, it's something that we definitely just need to work towards every day at improving. So thank you.